The Department of Surgery Competency Committee Resident Status Report has been crafted and designed to facilitate the review process of a resident by the primary reviewer as well as the Competency Committee. The form is sent out to the primary reviewers, pre-filled by the program administrator with the name of the trainee, date of last review, reporting period, trainee CBD stage of training. As well, any actions and recommendations from the last CC report are populated, as well as rotations that have been completed since the last meeting. The primary reviewer reviews the resident in the Elantra platform. Initial global EPA review is performed, looking at the attempted EPA observations and asking questions such as, are there regular and consistent EPA assessments being completed? We have set some standards within the Department of Surgery as what is expected and what constitutes either progressing as expected, slightly behind, or significantly behind. There are spaces for comments from the primary reviewer. Elantra also allows a normative assessment of EPA achievement, looking at total EPAs, achievement rates, progress percentage, and this can be comparative data to respective residents within their cohort. The primary reviewer then does a specific EPA assessment review for each EPA, considering the diversity of assessors, trends of learning curves, contextual variables, and forward progress. Individual EPAs per stage can be then checked off as either not started, in progress, or achieved. Again, there are boxes that allow for comments. Once the review of the individual EPAs has been completed, the primary reviewer has access to the resident's portfolio to look at some of the secondary metrics. Such metrics include in-training assessment reports, looking for any concerns with respect to the specific CanMeds roles that are explicitly defined within the ITAR. Specialty-specific examinations can be reviewed to see if there are any concerns with respect to exam performance. Surgical logbook functionality can be reviewed. There are a variety of different ways to have residents log their surgical activity. At the University of Ottawa, we also do an annual Pulse 360 report with an annual report that is generated and reviewed by the program director. This can also be assessed by the Competency Committee reviewer. At the Competency Committee, identified strengths as well as areas of improvements are listed. The learner is deemed to be either on trajectory or off trajectory, and if off trajectory, there are reasons outlined below. The Competency Committee then makes a recommendation as to the status of the resident, progressing as expected, not progressing as expected, progress is accelerated, failure to progress, or inactive. Learner actions are then recommended with either continued monitoring, development of any individual learning plans, informal remediation or formal remediation, or promoting learner from one stage of CBD to the next. The Competency Committee can put forward action plans to be considered by the RPC. And then lastly, decisions made on how to inform the resident, with either uploading the report to Elantra and emailing that report to the resident, meeting with an academic advisor, meeting with the program director, or a formal meeting with the RPC can be requested.